let our team. Great, thank you. All right, so next slide, please. So hi, everybody. Welcome to the next webinar in our Reentry Initiative Learning Series. Today, we're focused on Apple Health client eligibility and enrollment. So in the past, we did provider enrollment. Today, we're talking more about Apple Health client eligibility and enrollment. My name's Emma Oppenheim. I'm the Medicaid Transformation Project Director. I'm just going to do the intro again today and then turn things over to our subject matter expert team to do the full presentation. And then like last time, we'll have a bunch of questions at the end. Next slide, please. I think I went through all of this. Next slide, please. No AI note-taking tools, please. Oh, all right, great. So we have a really packed agenda for today. We're going to kick off with that program requirements that we've been doing on each webinar slide. Then we're going to talk about a number of different topics, including data sharing, coverage during incarceration, verifying Apple Health eligibility and enrollment status, Apple Health applications and how you can receive assistance getting somebody an Apple Health application, Apple Health notifications, and then we're going to do a Q&A. Next slide, please. So we have a bunch of different objectives for today. The first one is to understand how we verify Apple Health Medicaid eligibility and enrollment status. We're going to talk about the suspension and unsuspension of an individual's Apple Health Medicaid coverage and the 90-day pre-release benefit period. We're going to talk about best practices and requirements for providing services to individuals with short-term and then with long-term stays. And then we're going to talk about Apple Health screening, applications support, good topics like that. Next slide, please. So I'm just going to do this program requirements overview that you've probably seen again in the past. So next slide, please. I'll skip some of this. So again, we're talking about milestone 2, capacity building application, and milestone 3, the readiness assessment. So just your brief reminder that in the milestone 2, each attestation that we're calling them is a program requirement. And so for milestone 3, we're going to ask that you write and explain how you met each program requirement. And so goal of the learning series is to walk you through each of the requirements so you understand how to achieve them. Next slide, please. I think we can skip the next one probably. Oh, no, not this one. Thank you. So today we're talking about client eligibility and enrollment and actually the Consolidated Appropriations Act. And so if you have your capacity building application open, we're asking you to go to section 3, which is Apple Health intake and release data, screening, application support, and release date notifications. And today's webinar is going to cover attestations, the requirements, questions number 1 through 7 in that section, and 9 through 12. So a lot is being covered today. Yeah, next slide, please. And we pretty much talked about all of this today, but the requirements, you can lump them into a couple of different categories, including data sharing with HCA, verifying Apple Health eligibility and enrollment, applying for Apple Health notifications, and then checking estimated release dates. So I'm not going to go through every requirement number today because we have so many, but this is sort of a summary of what we're talking about. And we encourage you to look at the capacity building application to look at the specific requirements. Next slide, please. But we've also listed them here. So I think we can go through these quickly, but we've tried to group them into topics, and then that should help you follow along. Next slide, please. And then I think we have one more slide. Sorry, next slide, please. We just wanted to include them all here. They're all here. You can go ahead and look at them in the webinar deck, but we're not going to walk through them today. All right, we have a bunch of content, and I'm going to turn things over to our experts. So Tamara, over to you.
Thank you so much. Hello, my name is Tamara, and thank you for joining in. I am a policy manager in eligibility, policy innovation, and customer experience team, and I will turn my camera off to keep the distraction to minimal. Thank you. Okay, let's start with a short overview of Apple Health's Reentry Initiative. Next slide, please. Apple Health or Medicaid is a general name for Washington Apple Health programs administered by Healthcare Authority or HCA to include Medicaid, Children Health Insurance Program or CHIP, foster care, and other healthcare programs. When an individual with Apple Health is incarcerated, their coverage is suspended. And during this period, Apple Health covers inpatient hospital stays only due to federal Medicaid law known as inmate exclusion. All other health services are provided by facilities. Yet, Reentry Initiative introduces an exception to the payment exclusion rule, allowing a targeted set of Apple Health services up to 90 days prior to individual's estimated release date, or ERD, from a jail, prison, or juvenile correctional facility. Next slide, please. Next slide. And then next. Thank you. While discussing reentry, it is important to share more about new federal legislation, Consolidated Appropriation Act of 2023, or CAA. It created exceptions to the inmate exclusion and requires states to provide Apple Health services to eligible juveniles while incarcerated in a public institution. CAA of 2023 included two sections relevant to the topic. 5122 allow full scope of Apple Health services for juveniles in pre-adjudication. 5121 requires a set of pre-release services for the juveniles in post-adjudication. These laws are mandatory for all facilities statewide for all eligible juveniles. Please note that CAA eligible clients are juveniles through the age of 20 and foster care alumni up to the age of 26. Next slide, please. Thank you. In Washington state, both provisions 5121 and 5122 of CAA of 2023 will begin implementation in July of 2025 alongside of the Medicaid Transformation Project 2.0 Reentry Initiative. Facilities participating in the Reentry Initiative will be in compliance with CAA requirements. Facilities that not participating will still need to meet both CAA requirements pre-adjudication and post-adjudication. Next slide, please. Let's move on to data sharing. This is a high-level overview of the topic. Next slide. Providing pre-release services to eligible individuals will require data sharing between carceral facilities and HCA. Currently, jails and prisons have automated data sharing with HCA. So for individuals within Department of Corrections or DOC, HCA uses a nightly interface to place incarcerated individuals into a suspended status. To suspend coverage for individuals in city or county jails, HCA partnered with Washington Association of Sheriffs and Police Chiefs, or WASPIC, to receive daily statewide bookings and release data. To support the needs of youth in juvenile rehabilitation or JR residential facilities, HCA partnered with Department of Children, Youth and Families, DCYF, to process incarceration notifications, eligibility, and enrollment manually. HCA will work with other facilities, such as juvenile detentions and tribal jails, who do not have access to existing automated booking and release notifications, to set up processes needed for program administration. Next slide, please. Let's review reentry service coverage. Next slide. Thank you. If an individual becomes incarcerated in DOC or GR facility, they are placed in a suspended status and are eligible for pre-release services 90 days before their ERD. If an individual becomes incarcerated in a jail, they are placed in a suspended status and are eligible for pre-release services for their first 90 days of incarceration. This will also apply to JD facilities when processes are in place. Apple Health clients are re-enrolled in managed care 90 days before their ERD when known, and also incarcerated individuals are eligible for inpatient hospital stays throughout their incarceration. More information on 90 days tracking and related processes are going to be available in the Reentry Policy and Operation Guide. Next slide, please. Thank you. For pre-release coverage period, we define short-term and long-term stays. With short-term stays, such as in jail, if ERD is unavailable, pre-release services may be received for the first 90 days of individuals' incarceration. If ERD is received, pre-release services are covered during the 90 days prior to release. This will also apply to JD facilities when processes are in place. While with long-term stays, such as incarcerations in prisons or JR facilities, pre-release services are allowed 90 days prior to their estimated release date. To accommodate changes in release dates or in carceral setting, the 90-day period of pre-release services may be restarted, which will be given an individual a new 90-day period of pre-release benefits, regardless of how many days were used in the first set of 90 days. Next slide. Thank you. In this slide, we provide a few scenarios of incarceration updates or changes, such as release or rebooking, or transfer to a different facility that may lead to the restart of 90 days pre-release service period. Again, a restart will give an individual a new 90-day period of pre-release benefits, regardless of how many days were used in the first set of 90 days. So, when individual is incarcerated in a jail, pre-release services are allowed from the day of booking and continue for up to 90 days. When an individual incarcerated in a jail receives an ERD or their ERD is updated, pre-release services are allowed 90 days prior to their updated ERD. When an individual is released and rebooked the same day, up to 90 days of pre-release services are covered for each unique booking. When an individual is released from one jail and transferred to another jail, up to 90 days of pre-release services are covered for each unique booking. When an individual transfers from a jail to a prison, pre-release services restart 90 days prior to ERD. Next slide, please. After the incarceration is ended, an individual's Apple Health coverage is unsuspended and they are eligible for full coverage benefits. They are also going to be enrolled in their managed care organization or MCO if applicable. We have added the MCO information and their contact numbers in the resource page. Individuals who are enrolled in Apple Health upon incarceration will stay assigned to their managed care or fee-for-service unless an individual requests a change to their enrollment. An exception to an individual being assigned to a managed care at the time of incarceration is if they are in a long-term stay facility, such as prison or JR facility. This population will need to select MCO or they will be auto-assigned an MCO when their pre-release services begin. Next slide. Let's look at the client eligibility and enrollment. Next slide, please. We are going to review some of the capacity building application requirements. A carceral facility, CF, with short-term stays, such as in jail, screening individuals and for Apple Health eligibility for 24 hours of intake and provide Apple Health application support. SEF with long-term stays, such as prisons or JR facility, must screen and provide application support for their individuals 90 days prior to their ERD. It is the provider's and/or facility's responsibility to verify whether the client has Apple Health coverage for the date of service, and if so, to check the limitations of the client's medical program. Next slide, please. Facilities have two ways to access Provider One and verify individuals' Apple Health eligibility and enrollment status. We have Provider One, where Apple Health billers or providers have direct access into Provider One by using the Provider One provider portal. And we also have One Health Port, a secure portal where Medicaid billers or providers can access Provider One. Next slide, please. Provider One allows access for Medicaid billers and providers to view some information that might be very useful. Some of it include verifying client eligibility for services for both Magi-based and classic Apple Health programs, prior authorizations, claims inquiry and submissions, claim payments, managed care enrollment, social service authorization and billing, and track 90-day eligibility for targeted set of Apple Health services and billing. Next slide, please. If an existing Apple Health client is incarcerated, their Apple Health coverage will be suspended in Provider One. The MCO that is assigned to the individual is going to be notified of their incarceration date and carceral facility. Suspended Apple Health covers only inpatient hospital stays, and effective July 2025, a targeted set of Apple Health services up to 90 days prior to individuals' estimated release date. All other services during the suspended timeframe would be covered by carceral facility. Next slide, please. Let's look in more details on how to apply for Apple Health programs and any assistance available. Next slide. Based on capacity building application, carceral facilities participating in the Reentry Initiative are required to support reentry services and activities to include assist with applications for Apple Health coverage by submitting an eligibility application and enrollment selection if applicable. Submit application for Apple Health within 2 business days of individual's intake based on client's ability and willingness to provide appropriate information. Report address changes on the Apple Health application and provide contact information for Apple Health support. Next slide, please. For the purposes of eligibility and processing application, Apple Health is divided into 2 application pathways: modified adjusted gross income or Magi-based programs and classic Apple Health programs. For Magi-based programs, eligibility criteria varies for each program and is based on household size, tax filing status, and income. For classic Apple Health programs, eligibility and requirements vary for each program, considering income and resources. Note, facilities need to determine which Apple Health application pathway should be used based on eligibility criteria. Next slide, please. Apply for Magi-based coverage online through Washington Health Plan Finder, or HPF, if client is an adult age 19 to 64 years old, applying for children, a parent or caretaker applying for children, a pregnant or applying for someone who is pregnant. Next slide, please. On this slide, we list some options facilities can use to support and facilitate individuals applying for Apple Health Magi-based programs. This can be done online, by phone, or paper application. Individuals who are newly enrolled in Apple Health upon incarceration will be auto-assigned an MCO with a choice period to change plans. After eligibility is confirmed, the system will suspend coverage automatically overnight. Next slide, please. Apply for Apple Health Classic coverage online through Washington Connections. If client is an adult age 65 or older, eligible for Medicare, blind or disabled, need long-term services and support. Next slide. On this slide, we list out some options facilities can use to support and facilitate individuals applying for Apple Health Classic programs with TSHS. This can be achieved through online using Washington Connections, paper, or request an application by phone. After eligibility for incarcerated individual is confirmed, the system will suspend coverage automatically overnight. Next slide, please. Facilities can train their staff to become volunteer assisters or work with community assisters or navigators. Volunteer assisters can assist individuals when applying or renewing Apple Health coverage for Magi-based medical programs through Health Plan Finder. Facility staff can complete HCA eligibility training for Apple Health Medicaid coverage to become a volunteer assister. That includes instructions on how to navigate HPF application web portal, security training, and eligibility factor. You must complete 7 modules and pass the training assessment test to become a volunteer assister. If your facility is interested in more in-depth information on certified volunteer assister, please contact us by emailing the address on the slide. Next slide, please. Thank you. Navigators located across Washington state are available to help customers sign up for coverage through Health Plan Finder. Navigators are trained and certified by the Washington Health Benefit Exchange to help individuals and families to complete their HPF application and enroll in health insurance coverage from start to finish. They also can support customers with cultural, linguistic disability, or other special needs. They can explain coverage options and the availability of financial assistance to lower the cost of insurance premiums. Next slide, please. If an individual is incarcerated by their home state, in our case, Washington, but sent to an out-of-state facility, the individual's home state remains their state of residence for the purposes of Medicaid eligibility. For example, an individual's resident state is Washington, but they are sent to an Oregon carceral facility. For the purposes of Medicaid eligibility, Washington state would remain their state of residence. If an incarcerated individual intends to reside in a different state after their release from a Washington carceral facility, the individual must apply for Medicaid in the state using their release mailing address. Medicaid does not require incarcerated individual to have a fixed or home address, yet they must list an address where they can be contacted after release. All facilities are required to make available information on Medicaid applications for other states when applicable, and if it is known that an individual will not be released into a community in Washington. Next slide, please. Finally, let's review Apple Health notifications, documentations, and benefit cards. Next slide, please. When applying in Health Plan Finder, clients have a choice to receive their eligibility notices by email or via mail to the address listed on their application. When applying through Washington Connections, clients will receive their eligibility notices by mail only. For all clients, a Provider One service card, a managed enrollment packet and the managed care card will be sent to the individual's mailing address that is on file at the time of application. It is important for carceral facilities to update individuals' mailing address in application file before the release. Carceral facilities are also responsible for assisting clients if they need support obtaining their benefits documentations. That would be it for me. Thank you for your attention.
Right. Thank you. That was really great. So we're definitely seeing some questions coming in chat and we stopped responding so as to not distract people. So I think what we're going to do is just go through one by one. And then if you have a question and you prefer to ask it verbally, please feel free to just raise your hand. All right. So our first question is about scrolling up. Placement in
I can
health.
go ahead and read off some of the questions. And some of these we might actually have to just take back because they are very nuanced questions. And so, we appreciate you all bringing this to us, because we're not necessarily aware of all the different situations you could possibly be in. But just to let you know. Okay, so we have from Anna, how does placement in competency restoration impact the 90-day window? Folks can easily be in restoration for over 90 days, depending on the charge and the situation.
So I think that one we're going to take back and then send a response back on that one. And it would probably depend on whether they were considered released and then returned back to a facility. Thank you.
Great. And we have several questions about how the 90 days is sort of functioning. So I'll go ahead and read Michael Oliver's, which is very similar to Ed's. In juvenile detention facilities, if no ERD is available upon admission, the first 90 days are covered. What if an ERD becomes available? Is it still in the first 90 days, but the ERD is more than 90 days out? Does coverage suspend until the 90 days prior to release?
And then Tara from our team, would you like to answer these questions or?
Can you hear me?
Yes, you're good.
Okay. So I think there are some of the nuances I think that would be more appropriate to respond in writing, because I also think that with answering with every new or an update or a change to the ERD and how that would restart the 90 days, there may be also be follow-up questions to it. So yeah, I think that we'll bring some of the timing, 90-day timing and tracking back so that we can try to put different scenarios together. I appreciate these questions though, because it creates new scenarios for us to clarify.
Is it possible for us to just go over how the 90 days functions when someone receives a new ERD? I think that would be helpful.
Yeah, so, and also Michael, right, in regards to your question with the JD facilities, those would be manual processes. And so some of that will also work just a little bit different. So just as the 90 days. So do you mean, Michaela, like if there is a transition or a different, like the scenarios that we already reviewed, you can give me a little bit more detail on what you're looking for.
Yeah, it just seems like folks are not quite sure how like the reset functions when we get a new ERD. So if we could just review that, that would be awesome.
Yeah, so I mean, if somebody goes into a jail, from the day that they're booked, and we do not receive an estimated release date, we don't with many today. um, they would have those pre-release benefits for the first 90 days. If we were to receive an estimated release date within, then yes, it would be suspended. There'd be a disenrollment.
I see Lisa from DOC's hand up. Go ahead.
Yeah, thank you. And just to build on this same topic, let me give you a scenario for DOC. So once an ERD is set, we would base our 90-day pre-release services off of that expected release date. Now, if something occurs, they receive their doctor's appointment or some type of billable service that was allowed, and then something happens in the extended or the ERD is extended. Our question is, because at the time of that the service was provided, they were correctly in the 90-day pre-release period, would we still be able to receive the reinvestment for that, or would it then become we would not be able to because the ERD changed after that?
So are you saying when does it change? I
So,
might have missed that part.
just say, for example, at 45 days, an individual is receiving targeted reentry case management, reentry targeted case management, there we go, services, and we bill for that service. Then the following week, the individual infracts, loses good time, and the expected release date is extended. During the time that we billed for that service, they would have been eligible, but now with that loss of good time, they are outside of that time frame and are no longer eligible. So our question is, since they were at the time of the service, will that still count as a reimbursable service? Or does it nullify that despite the fact that it was eligible at the time that it occurred?
Is it okay if I take this?
Yeah, I think
That's a great question. So great question. We're seeing a lot of similar questions come through chat. So I think the short answer is that services in that 90-day window, and then there is a shift in the 90-day window, would be covered in both scenarios. And that's because we can only operate with the information that we have at any given time. We're not going to hold anybody like liable for a service that was provided during a period of time that we all thought that was the 90 days. So short answer is yes. Long answer is we're going to have a lot more detail on this and how to track this. That's probably not the best word because it should not be manual in most cases in the policy and operations guide, which will be released in February.
Thanks, Emma.
Yeah.
Okay, great. Thank you, Emma. Tara, would you mind clarifying Apple Health Classic versus Magi? That would be really helpful.
yeah. So Magi, which is our modified adjusted gross income for Apple Health programs, is ages 0 to up to 64 or 64 through 64, and not on Medicare. So, and then our classic Apple Health, which is disabled by federal definitions and mostly receiving SSI or Medicare. So that's where some of those long-term care supports would come in. And I think there was a question, not sure where that went, but there are definitely different scenarios, right, for the different pathways of what application, whether it be a classic Apple Health or a Magi-based Apple Health. Ed, I think you asked, right? Need a better definition of long-term care. Happy to take note of that and make sure that it's in the P&O guide. But if you have any questions, follow up, please let us know.
No, I mean, that's just it is what, the definition of those two different plans and you say long-term care, these people are coming in at their lowest points and we're finding, things that haven't been caught before, especially if they're staying here longer, they're going through withdrawals or detox, they're finally getting medical attention, getting the tests needed. And so when you're going through the MAGI and the other one, the bottom bullet point on the classic was, long-term care or concerns. I mean, that's a pretty substantial list for those that are incarcerated.
Yeah, so I think the a good separation would be, are they currently disabled, right? Have they applied, right? And are receiving SSI or Medicare due to a disability?
Okay, let's go to maybe an easier question. What if the person is experiencing homelessness and has no mailing address?
So you
Yeah, go ahead.
that would be a part of the training, or the sisters or navigators could help with that. There's ways to navigate that through the application process.
We also got a question again from Ed about how the 90 days and services function if they are from another state.
Say that again, Michaela.
Well, the word for word question is, so if they're from Idaho, they won't have the 90 days coverage in our facilities. I think this is a broader question on how services will function for those who are not Washington residents.
Yeah, I'm going to turn that question over to you.
Sure. So I interpreted this question as a question about whether an individual would be eligible for Apple Health because their home address is out of state, right? And so you need to be a resident of Washington to receive Apple Health. And then our program is for folks who have Apple Health, right? We have minimum requirements around screening for eligibility. We have minimum requirements around submitting applications. But yeah, if we determine that they're not a Washington state resident, they're not eligible for Apple Health, then that would impact their ability to participate in the program where you could be reimbursed for healthcare services. So I think that's what I will say right now. And if you have more specific questions about that, please send us an email to talk about it with us. And I would definitely love to hear from facilities if you feel like that's a lot of folks you're seeing, like more than a plurality of people are in this situation, just so we have some awareness of who is impacted the most. Probably border cities, it sounds like.
Thanks, Emma. This is a good question from Bobby. Someone booking into jail may not initially qualify, but after months in jail, they have no income and the home situation may be affected. Are we okay to rescreen as they would then qualify?
I'll take this one too, Tara, if you don't mind. So yeah, you're definitely okay to rescreen. Nothing preventing you from doing that. We have, again, a minimum requirement about how quickly we want folks to be screened in a facility, and then how quickly we want applications submitted for folks without coverage. But absolutely, you can rescreen, and it's to your advantage, right? So if someone wasn't eligible and then they become eligible, you would be eligible for reimbursement through Apple Health for the 90-day pre-release period. So it's a good thing to rescreen, and it's a good question. Thank you.
Emma, can you also address the concern around complexity for tracking 90 days?
Yeah, so we didn't want to go into too much detail on this in this basically intro webinar. There's going to be a lot of additional detail in the policy and operations guide section, which is should be coming in February for this section. And so the short answer that I'll just give is that you're not going to need to manually count days for the vast majority of people. It won't be like somebody has to know what date they entered and just like do a bunch of math every time they give them a service. We're going to have a system solution again for the vast majority of people and more information. So system, and when I say system solution, I mean you would be able to go into our system, check if they're eligible, and know that they're in their 90-day period without needing to do any math or anything like that. And for the vast majority of people. There will be a minority of people that there will be some limited tracking for, and we'll have more detail on that, but not for the vast majority. And yeah, more to come in the policy and operations guide. It's a really good question. Absolutely understand your concern.
Next question is, many inmates in jail have extended stays related to trial, often years, and never really get an estimated release date. For example, someone will go to trial and they're found not guilty or get time served. These fall through the ERD identification issue.
I'll take this, Tara. I hope it's okay that I'm answering so many. So, yeah, that's a really good point. And I think a big challenge that, let's talk about it. So I think a challenge for our jails is absolutely that we don't necessarily have estimated release dates, right? So I think best I can tell you is that if you as a facility feel like you have an estimate based on what the charge is and your experience, you could enter one and we could use that. We will be monitoring to make sure that facilities aren't like abusing that power of just re-entering estimated release dates, but we don't expect that that would happen. And we think that this is a limited case scenario. So if there's somebody that you believe is in that 90-day pre-release period, you feel comfortable adding an estimated release date that can open up access to services in a situation where it might be sort of unclear. And we can definitely talk a lot more about that in one-to-ones if that would be helpful. And we'll have some more clear guidance on that situation in our policy and operations guide.
Okay, someone asked if we could post a slide deck, and I'll go ahead and drop the link because it is already posted on our website. And then Kathy, we're working on the policy and operations guides, but we'll also be posting those to this website, I believe. Okay, got something from Anna. We have requested help from community volunteer assisters previously and have been told there's no capacity within local navigator teams. Who/how are folks thinking labor will come from to complete and submit applications?
Yeah, that's pretty unfortunate. I think we actually probably have talked to you already, but let's talk again and give you a little bit more, maybe some other connections into the community where we can find them. Yeah, that is not ideal. Ideally, we would have someone, a volunteer or an assister that could help you navigate it. So please email us. Sorry, that wasn't clear.
Can you back bill for the 90 days pre-release? For example, you have someone incarcerated for 180 days. The first 90 days they're eligible, but then they are suspended. Can you bill for that second 90 days as you didn't know their expected release date?
That is a bit of a different situation that we haven't talked about internally, but I like where your head is at. And I think let's take that one back and see what we can do there. That's a really interesting question. I think what we were planning for was that any services billed in the 90 days pre-release, even if we didn't have an estimated release date, were going to be allowable, and there was no concern about that, which is basically the exact same situation. I think what you're asking is, can we hold claims until we know for sure, which would be an even safer bet, and we would appreciate that. So let us take that back and provide some guidance on that. Great question.
And then one more, slide 28 shows existing Apple Health client is incarcerated. Their Apple Health coverage will be suspended. What about in juvenile detention where the first 90 days are covered if no estimated release date is available, as indicated on slide 21?
Go back to slide 20. Oh, sorry.
And I think this might be confusion about what suspended coverage means.
My brain is not working on this one. Tara, could you help?
Yeah. So if an individual comes in and they are placed in suspension, they're disenrolled and they'll have a suspension. And typically they would be disenrolled from their MCO. But they will still show enrollment because they will have the pre-release benefits eligible for those for the first 90 days. There's also a couple of different pieces around JD and the CAA considering the post and pre and post adjudication. So Michael, happy to follow up with a little additional information on the process for juveniles.
And that's it for our questions in the chat. Do folks want to raise their hand and ask any questions or clarifications on these different ideas or definitions of things? If you have any questions, like, please raise your hand.
I got a weird question. Why are we suspending their insurance when they come to jail still then?
Karen, do you want to take that one?
Are you saying for juveniles or for adults?
For adults, am I correct in what I saw on the slide that
So
we're suspending it?
it'll show suspension, right? And provider one, it'll show suspension, but they'll be eligible for inpatient services and pre-release benefits.
But if we want to cover anything during the 90-day window, then we have to re-enroll them?
No, they would keep their enrollment. So they'll show suspension, they'll keep their enrollment. Current day, they are disenrolled. So during this pre-release, 90 days eligible for the pre-release services, they will stay enrolled if they have managed care.
Okay.
If they go past the 90 days, we didn't have an ERD, they'll be disenrolled.
Not suspended, but disenrolled, or are those the same
If they're
things?
still going to show a suspension.
Okay.
Hey, Tara, can you please clarify what suspension means in this case?
Say that again, you cut out for me on the.
I was just asking you to clarify the difference between suspension and disenrollment and sort of clarify what suspension means in this case.
Yeah, so everybody goes into a suspension. They'll show suspension when you are incarcerated. In this, without being too weedy, so the suspension is still going to show your MCO enrollment. And you'll be eligible for the inpatient stays and the pre-release services. After the 90 days, if we never receive an ERD, so the 90 days, you will be disenrolled from the MCO and no longer eligible for the pre-release services, but you will be eligible for the inpatient stays. Does that help clarify it, or is there a better way I can clarify?
So Tara's basically talking about the automatic way that we'll know whether somebody's in their 90 days, which is whether or not they'll be enrolled in managed care. And we're going to have this is probably really complex to talk about verbally. There's going to be a lot more information coming on this in our policy and operations guide. I think the other thing I'll just flag is, why did we continue to put people into a suspend package? That was just the easiest way to operationalize this as a program, to have to make fewer system changes and be able to go live earlier.
And then so the suspension thing, the disenrollment comes if we don't give you an ERD. But if we don't have that's going to be the complicated thing for us, is knowing an ERD. I've got 51 inmates right now. I've got 2 that have a release date. The rest are all pending trial and deals and everything else. So potentially I'd have 2 that I could keep enrolled and another 48, 49 that would all get disenrolled.
Totally. Tara, is it okay if I talk about this a little bit more? So, well, in I think for most folks in jails, our understanding is that vast majority of people should be in and out in under 90 days. So we're really hoping that this only applies to like 5 to 10% of the people in a jail facility. But you could use managed care enrollment. That's going to be the automatic way that we'll track this information. we can provide some more I think I really loved the piece of feedback we got earlier. We could provide some more feedback about submitting claims from a period of time in the true 90 days prior to release. I think a challenge for us has been, yeah, never mind. Estimated release dates are really tough.
John, is that giving you some clarification?
Yeah, yeah. It's all, this is all very complicated. So it all kind of comes back to my original point 2 years ago or 3 years ago when we started this is why are we taking away medical insurance from people that are innocent until proven guilty? We might as well just cover them all until they're found guilty and then take it away. So much simpler. I'm just saying.
I know. I'm just going to try and repeat what Emma says without muddying it up, and what Tara said, but the reason we do suspension is that it's the only way to offer the limited pre-release services that the state's been approved to cover. Otherwise, we'd have to provide the entire Medicaid coverage, which you've articulated would sure be a nice way to do it, but we don't have the authority to do it. So that's the only reason we do it. And then yes, as Tara and Emma have said, when someone is booked, if there's not an estimated release date, then we start the 90-day duration. If they receive the full 90 days, then the suspension for the pre-release services has to end.
No, I get it.
Yep. Alrighty.
Yeah.
Thank you.
No, you've helped a lot, Mike. I appreciate it. You guys have a tough job, so I'm not trying to nitpick at you. I get it. You guys do the best you can. We do appreciate it. Thank you.
Okay. Thank you. Thanks for the patience. Back to you, Emma, Tara.
Michaela. Okay, so Nori asked this question, and I think it sort of gets at a question that was asked earlier, but that was maybe unclear, which is how does the process differ for juveniles in detention since they don't seem to be suspended upon admission into county facilities?
So this is Tara. There's a couple things. Juvenile detention facilities are going to differ because it's going to be manual processes that we will coordinate together if they're participating. But it's also different with the CAA of 2023, where the post adjudication, where they already have a sentence, they would be eligible for the 90 days. And then the other piece to the CAA would be the pre-adjudicated having full Medicaid benefits and not being suspended. So I think there's more to come on that, more details around the juvenile detention processes and what that suspension looks like.
Thank you. Got another question. Will services provided by third-party services in jail be eligible for Medicaid reimbursement if the jail is not in a cohort?
I'll take this one. So yeah, great question. So you have to be in a cohort, you have to be live, you have to have passed the milestone 3, which is our readiness assessment, and then you need to be like live in your cohort to bill for services. That's really important. We're going to be monitoring for that on the back end. If there's any questions, concerns about that from a facility, please let us know. But you do have to pass that readiness assessment to be able to start being reimbursed for services billing us.
Okay, we've come to the end of our questions and we have about 5 minutes left. Takina, can you go to the webinar schedule slide so we can give a little, there we go. If anyone has any last minute questions, feel free to raise your hand. But outside of that, we have another one of these next week that we don't have specific programming planned for, but it will be an open forum so you can come with questions about whatever we have covered so far and maybe even things we have yet to cover. And we're going to do our best to have subject matter experts in the room that can answer the questions that you have.
Thank you so much, Michaela. And I think I'll just do a plug for it. If there's specific questions that you have today, get started on your list. Feel free to email it over to us and we can start walking through those next week. That would help us be most prepared, but you can also just bring questions.
We had one more thing added into the chat, but it seems like something we're going to want to take back.
We're going to take back the back billing situation. Thank you. That's a really great question. So, and I think to the other question I'm seeing from Kathy, essentially, yes, we're going to restart the 90-day period for an individual. If they come in, they don't have an estimated release date, we give them the first 90 days. If then, okay, we suspend, or I don't want to say suspend. You can no longer bill for them after they hit that 90 days. If we don't have an ERD, if around day 100 we receive an estimated release date, then they would get that, whatever the 90-day period is prior to the estimated release date. If, let's say they're in for 120 days, we didn't have an estimated release date up until day 100. That first 90 days should be eligible. That last 20 days, you would know that they received, you would know that they were eligible for that last 20 days. And then we're going to take this question back around back billing. I think that's a really important question. I see a question about MCOs in the meeting next week. I believe the answer is yes, and we can double check that. All right. Is there a slide after this? I can never remember. That might be it. So just a few more resources. And unless we see, we can hang on 1 or 2 more minutes, but unless we see another question, thanks everybody. Great conversation today. And we appreciate your time and we'll see you next week. So have a good afternoon.
Thank you guys. Appreciate the help.